Mr. A presents for an in-person visit on October 10th. After several weeks in treatment, Mr. A's sleep and energy level have improved, but his patient health questionnaire score remains elevated at 14. The BHCM reminds the PCP of the psychiatric consultant's most recent recommendation to increase the bupropion as R dose to 150 milligrams twice daily. Additionally, the BHCM discusses the goals and progress of problem-solving treatment with the PCP. This discussion lasts 5 minutes. Mr. A is offered a stepped care in-person visit with a psychiatrist and agrees to schedule for the following week. Minimal qualifying psychotherapy is delivered. On October 10th, the BHCM visits with Mr. A for 15 minutes and discusses his progress with the PCP for 5 minutes. The BHCM also spends 5 minutes completing the registry. For these activities, the BHCM records 25 minutes of CoCM services. The following week, on October 17th, Mr. A sees the psychiatrist for an in-person visit. The psychiatrist does a full evaluation, including a mental health history, for diagnostic clarification and treatment planning. Findings are consistent with a diagnosis of major depressive disorder, which further corroborates the original diagnosis. The treatment plan is maintained, and Mr. A agrees to continue with the CoCM program. During this visit, the psychiatrist bills the appropriate E&M code for a face-to-face visit and CPT code 90792 for a psychiatric diagnostic evaluation with medical services. On October 26, the BHCM conducts a scheduled phone session. Mr. A has tolerated the increase in bupropion and reports a positive encounter with the psychiatrist the week prior. The BHCM administers the health questionnaire over the phone and Mr. A scores a 12. The rest of the session is spent on intensifying problem-solving treatment. During this visit, the BHCM records 15 minutes for the call with Mr. A and 5 minutes to complete the registry. For these activities, the BHCM must record 20 minutes for CoCM services. Mr. A continues to regularly complete the health questionnaire scales, which allows for measurement-based treatment to target and helps the team know when to intensify treatment. During the month of October, the psychiatrist billed one visit using the appropriate E&M code, and the BHCM recorded a total of 45 minutes of activities. BHCM activities were billed using the CPT codes shown on the screen. Mr. A returns to the clinic on November 8th for an in-person session. He fills out the health questionnaire and scores an 8. Mr. A reports more engagement in social activities and a reduction in smoking. The BHCM spends most of this session delivering problem-solving treatment. For this visit, the BHCM records 20 minutes for the visit with Mr. A and 5 minutes to complete the registry. For this visit, if eligible for reimbursement, the BHCM has the option to either bill CPT code 90832 for psychotherapy services, record 25 minutes of CoCM activities, or bill code 90832 for psychotherapy services and record 5 minutes of CoCM activities. If the BHCM does not have independent billing capabilities, they must record 25 minutes of CoCM activities. The BHCM and psychiatric consultant discuss Mr. A on November 15th and determine he is responding well to treatment and the current plan should be maintained, with continued work on the problem-solving treatment to accomplish his goals. For November 15th, the BHCM records 10 minutes for the conversation with the psychiatric consultant about Mr. A's treatment and 5 minutes to complete the registry. For these activities, the BHCM records 15 minutes of CoCM services. On November 23rd, the BHCM and Mr. A connect by phone after he misses a scheduled appointment. Mr. A reports his concentration is improving at work and his back pain has improved, and his health questionnaire score was down to 4. Mr. A continues bupropion 150 milligrams twice daily and ongoing follow-up with the BHCM for problem-solving treatment. For this date, the BHCM records 20 minutes for the phone call with Mr. A and 5 minutes to complete the registry. For these activities, the BHCM records 25 minutes of CoCM services. After 3 months of treatment, Mr. A's health questionnaire score dropped to a 4, and he reported that his pain was more manageable. Mr. A indicated that he added to his walking routine with his dog and began attending a twice-weekly aerobics class at his local community center. He reported feeling better connected socially, even though he occasionally has bad pain days. Mr. A also reported a decrease in irritability, which resulted in better relationships with his family. Finally, Mr. A planned a quit date for smoking cigarettes. During the month of November, the BHCM recorded a total of 65 minutes of activities. BHCM activities were billed using one of the CPT code combinations shown on the screen.